Welcome to our second module in the educational series, Overdose Awareness, Educating Youth in Canada. Today we will discuss the second topic, Young and Informed, Understanding Substances and Their Effects. The purpose of today's lesson is to gain insight and knowledge into the underlying causes of substances and their effects. This workshop aims to educate you with the necessary details about how different substances affect the brain and body, the short-term and long-term effects of substance use, and recognizing signs of substance misuse. Let's get started. Welcome back. For those who missed our first session, I'm Kasey. I'm in my final year of the Addiction and Mental Health program at Humber College, and I'm currently doing my summer placement with the Center for Grief and Healing. Let's continue with Module 2, where we will cover the topics and effects surrounding understanding substances and their effects. Today's agenda. Here's what we'll cover today. We'll start with an introduction to how drugs work, followed by an overview of different types of substances. We'll then dive deeper into how these substances affect the brain and body. We'll explore the short-term and long-term effects and identify the signs of substance use and misuse. Finally, we'll discuss when and how to seek help. Let's begin. Introduction to understanding how drugs work. Addiction occurs as a result of changes in the brain's reward system pathways. When these pathways are altered by substance use, the brain becomes highly responsive to the substance, leading it to increased release of dopamine, a neurotransmitter associated with pleasure and reward. This cycle of substance abuse, cravings, withdrawal, and compulsive behavior makes addiction difficult to overcome. Here's where we discuss the types of drugs. The drugs that we will be discussing are as follows: central nervous system depressants, central nervous system stimulants, prescription opioids, hallucinogens, cannabis, inhalants, and tampered opioids. There are various types of drugs that affect the central nervous system in different ways. These include depressants like alcohol and barbiturates, stimulants like caffeine and methamphetamines, prescription opioids, hallucinogens, cannabis, inhalants, and tampered opioids. Each category has distinct effects and risks associated with its use. Here is where we'll talk about today's most common drugs and how they affect us. A brief introduction onto the most common drugs are alcohol, which is a depressant that impairs brain function, breathing, and heart rate. Cannabis, which can cause anxiety, paranoia, and depression. It can also affect brain development in young adults. Prescription drugs can be risky without doctor's approval and can have psychoactive effects. Illegal street drugs are unpredictable and they can be high in potency and be extremely dangerous. Drug use among youth in Canada today can have severe consequences on their physical and mental health. The most commonly used drugs among youth are alcohol, cannabis, prescription drugs, and illegal street drugs. Alcohol is a depressant that impairs brain functions and vital processes. Cannabis, although sometimes perceived as harmless, can cause significant mental health issues and affect the brain development. Prescription drugs, as discussed previously, when misused, can have dangerous psychoactive effects, and illegal street drugs are especially hazardous due to their unpredictable content and potency. Welcome to the section that covers the brain. We will talk about neurons, neurotransmitters, and the impact of drugs on the brain and the brain's communication. The brain is a complex system of neurons organized into circuits and networks. Neurons send and receive signals through neurotransmitters, which transmit messages across synapses. Drugs can disrupt this communication by mimicking or altering the action of neurotransmitters, leading to abnormal brain function and behavior. In this slide, we will cover how substances affect the brain and body. We will talk about the different parts of the brain and their functions, and also dive into the impact of drugs on these certain areas. Drugs affect various parts of the brain, each responsible for different functions. The basal ganglia, involved in motivation and reward, can become overactivated, reducing pleasure sensitivity. The extended amygdala, associated with stress and withdrawal, motivates continued drug use. The prefrontal cortex, responsible for thinking and impulse control, becomes impaired, increasing compulsive behaviors. The brainstem, controlling vital functions, can be disrupted by opioids, leading to life-threatening conditions. How substances affect the brain and the body continue. In this section, I will give a more detailed analysis and explanation of what parts of the brain are affected by drug use and how. Starting off with the first part of the brain is the basal ganglia. It's involved in motivation and reward, forming habits and routines. Drugs overactivate this circuit, causing euphoria, but reducing pleasure sensitivity with repeated use. The extended amygdala is associated with stress and withdrawal, motivating continued drug use for relief rather than euphoria. The prefrontal cortex is responsible for thinking, planning, and impulse control. Drugs use reduces impulse control and increases compulsive drug-seeking behavior. The brainstem controls functions like heart and breathing, which are vital. Opioids can disrupt this area, leading to life-threatening conditions like respiratory depression, which can slow down or stop breathing. This lack of oxygen can lead to serious brain damage or death. The brainstem's impaired function also affects the heart rate, leading to cardiac arrest. In this slide, we will go over the short-term physical effects of substance use, and we will go over drugs such as benzodiazepines, heroin, alcohol, methamphetamines, and cocaine. Short-term physical effects of substance use vary by drug. Benzodiazepines can cause slurred speech and dizziness. Heroin and other opioids can lead to dry mouth and slowed breathing. Alcohol impairs coordination and can cause nausea. Methamphetamines increase physical activity and heart rate, and cocaine can cause erratic behavior and severe cardiovascular issues. Moving on. Now to the long-term physical effects of substance use. Long-term substance use can have devastating physical effects. Alcohol abuse can lead to heart disease and liver problems. Methamphetamine use can cause severe dental issues and weight loss. Cocaine and heroin can damage nasal passages, lead to infections, and cause significant weight loss. Chronic use of these substances often result in severe health complications and can also be fatal. Now, on this slide, we will discuss the short-term mental effects of substance use on individuals. We will cover prescription opioids, benzodiazepines, alcohol, methamphetamines, heroin, and cannabis. Substance use also impacts mental health in the short term. Prescription opioids and heroin can cause feelings of euphoria but lead to irritability upon withdrawal. Benzodiazepines and alcohol reduce anxiety but can impair memory and concentration. Methamphetamines increase wakefulness but cause anxiety. Cannabis can enhance sensory perception but may also lead to anxiety and irritability. Now, here we are at the long-term mental effects of substance use. Long-term mental effects of substance use can be severe and very long-lasting. Alcohol abuse can cause and lead to depression and social problems. Methamphetamines can cause paranoia and hallucinations. Long-term cannabis use can lead to mental health issues and trouble sleeping. Heroin, fentanyl, and prescription opioids increase the risk of overdose and can result in mental health disorders and physical disabilities. In this slide, we'll highlight the signs of substance use and misuse. We will cover behavioral and physical red flags of substance misuse. It is important to recognize the signs of substance use and misuse. Look for sudden changes in friends, eating habits, sleeping patterns, physical appearance, and school performance. Frequent requests of money, lack of interest, irresponsible behavior, and detection of drug paraphernalia are also red flags. Being aware of these signs can help in taking timely action. When to seek help. In this slide, we will discuss the steps to take if you suspect that your child is using substances. If you suspect that someone is using or misusing substances, it is crucial to act early. Plan your approach, talk to your child calmly, and focus on the behavior rather than the person. Encourage honesty and seek professional help if necessary. Do regular check-ins, and spending more time with your kids can also help. Early intervention can prevent further issues and support healthier choices. In our next module, we will focus on recognizing and responding to overdose situations. We will cover the signs and symptoms of overdose, immediate response actions, the role of emergency services, and managing the emotional impact. Thank you for your participation today, and we hope to see you in the next session. Thank you for joining us today. This educational series is extremely important to me, and I have created it in support with the Center for Grief and Healing, Bereaved Families of Ontario, Halton Peel. Your participation is valuable, and we appreciate your commitment to learning about overdose awareness and prevention.